You have to start recording now.
Okay, let me introduce our first speaker, Dr. Rupali Panse. Dr. Rupali is a resident of Florida and the Vice President of Ayurveda Association of Florida. She completed her Ayurvedic doctor degree in Tirak Ayurveda College, Pune University. She has recently completed her Masters in Nutrition from NSU, Florida, and she has written numerous books. She's been practicing in Florida for several years, and she's the author, blogger, educator. She's also been on several boards, board of National Consortium of Ayurveda. She's a member of GIST and a member of Society of Integrative Oncology. She has affiliations in different educational institutions at the Hindu University, at the CCIH, Pune University, at Sai Ayurvedic College, Miami. And her very popular books are Food Guru, and she has another bestseller in India. Uh, she has the bestseller in India by the name Uddara,
Rasta.
Udarastha.
Yeah, it's a
She's
Marathi
won
name.
2 national awards. One is for research by Khadiwale Research Institute in 2017, and a national award for a bestseller book by Ayurveda Vidyan Mandal in 2021. She's going to do a presentation about opportunities in Ayurveda education, and she had carried out a very successful, I don't want to call it mission, but um, carrying out really a successful mission to India with some students from US. Our second speaker today is Dr. Mohan Joshi. He's the Associate Dean and Professor and Head of the Department of Samhita and Siddhant at All India Institute of Ayurveda in Goa. This is a very big scale national initiative by Government of India, by Ayush Ministry, and he will tell us a lot about that. He's been in the teaching profession for 22 years and PG guide to 20 students. 7 of them have been pursuing their PhD currently. He has 16 years of experience in fundamental and clinical research. He is chief in curriculum development for NCISM in New Delhi and designing the undergraduate and postgraduate courses for Ayurveda, Unani, Siddha, and Suvarikpa. He is also a very, very resourceful and very renowned guest lecturer, and also being on many positions, key positions. Over 100 lectures have been delivered, which are getting CME, ROTP, and he has presented in more than 60 workshops, seminars, and webinars. He has authored 3 books and published journal papers, over 45 of them. So without taking further time, let's go straight into our today's topic. I would love to start with Dr. Rupali Panse.
Thank you so much, Aparna, for this warm introduction. Thank you so much. Welcome, everyone. I'm so glad to have all of you here today. I can see many students, many Ayurveda practitioner, Ayurveda enthusiasts who have joined in such a short notice. Um, being a speaker, but also being a part of Ayurveda Association of Florida, I welcome all of you. And from 2025 Ayurveda Association of Florida, every month we are trying to, give something different, something unique from Ayurveda perspective. And every month we are expecting to, introduce um, new case, new case study, and eminent speakers from different universities, institutes, and Ayurveda colleges. So I'm very honored and I'm very thankful for AAF for giving me an opportunity to start today's first session. So yeah, recently I've been back from India from a long educational tour, I will say that a batch of 12 students who are Ayurveda graduates. And usually their graduation, completed after their India internship, which is a very important part of all the Ayurveda education. So let me begin first with the background because Kifi especially, she is a very hardworking, always smiling board member of Ayurveda Association of Florida, and she wrote me, Rupali, we will like to hear all your experiences about this India internship. So why don't you talk about that? Because clinical practice or clinical training in case of Ayurveda is really very important. Specifically, when you are studying Ayurveda in United States, where you don't have access to your clients and patients directly, you don't get visit to Ayurveda hospitals. There are no full-fledged Ayurveda hospitals yet, but I'm really very hopeful there will be full-fledged Ayurveda hospitals very soon in United States also. So yeah, clinical training in Ayurveda education is really very important. So I came here in United States in 2019 and I started teaching few Ayurveda schools here, which are doing wonderful job. And trust me, students are so I mean, they are very eager to learn about Ayurveda. They dedicate their time, energy, and whatnot. And absolutely, it's a delight to teach them. It's a delight to interact with all these Ayurveda students. And I was curious about their India internship. I was very much interested in offering them much intensive training or exposure to bigger setups than just private hospitals, where you can actually see the integrative approach of modern medicine and Ayurveda working hands in hand together and serving hundreds and thousands of patients in a single day. So yeah, I began with a few Ayurveda institutes. Then I approached All India Institute of Ayurveda, which is a very nice setup. It's a huge hospital with all modern facilities and completely full-fledged Ayurveda hospital situated in a very serene outskirts of Goa. And um, I will share the experiences at the same time. I can see many Ayurveda students here. So for few of them, it's just a beginning of Ayurveda course. So they should understand, where to apply all these Ayurveda knowledge they have learned and how to deepen them or how to make it completely, practical in clinical setting. So that is the whole purpose of my 20 minutes presentation. I have not prepared any slides or like that, but I would like to interact just like that. So yeah, every Ayurveda degree, it comes with a mandatory internship, which is definitely a very important aspect because Ayurveda is a very different medical science. It's the siddhantas or the fundamentals or principles, theories, they are very different from the modern medicine. So you have to learn first a little bit of Sanskrit words. You have to understand the holistic approach of body, mind, and soul to learn Ayurveda more in depth. So when we learn about dosha or when we learn about various symptoms of diseases, we learn them theoretically, right? Your mentor or your teacher, um, they put their best efforts to understand or to make you understand the Ayurveda theories theoretically. But when we say that, tongue examination is the one of the important step of Ayurveda assessment, then if you have not observed the tongue of at least 100 people to categorize various doshas or to categorize various symptoms of diseases, your theoretical knowledge is not going to help you at all in your practice. So this is just a simple example why clinical practice is important. The same goes with the, ama is a very different concept in Ayurveda, and ama is nothing but the internal toxins. and almost a whole chapter is dedicated to ama or internal toxins, which is supposed to be the main culprit of almost all non-communicable diseases. So how to differ ama and how to differ other involvement of internal toxins and pure diseases without internal toxins. So for that you have to do the Ashtavida Pariksha, you have to actually talk with the patient. Actually, you have to see the skin texture, tongue, eye examination. You have to overall know the pulse examination. Nadi Pariksha is also very important. So, categorizing pulse into the Vata, Pitta, Kapha, or Sama or Nirama state of the disease is really very important. So, that is the goal, or that is the aim of any clinical training, whether it is India internship or whether it is internship in United States. So, that is the main essence of this clinical training. And few things you get as perk. So I would like to introduce first, which is total commitment. When you are doing your clinical training, you have to commit your morning to night time for exclusively for training, right? So in AIA, our day started with the yoga at 6 o'clock, and there was a wonderful yoga therapist, yoga teacher who dedicatedly was teaching us various aspects of yogasanas, various aspects of yoga siddhantas, etc. So Aparna, I request you to just remind me about timing. Whenever 20 minutes are finished, please just let me know, because the main attraction of today's presentation is Dr. Mohan Joshi, who is going to share a wonderful, interesting case with all of us. So just let me know. So yeah, commitment is really very important, because the whole day you are just thinking about clinical training, you are visiting hospital, you are going on the rounds with the renowned doctors who have more than 20-25 years experience. You get to see patients which are minimum like 500 to 800 patient footfall in the hospital. You will get accustomed with how these big hospitals are running Ayurvedic settings. It is really fascinating to see how Ayurveda practice can be integrated with the modern equipments, advanced technologies, and modern consultants working together with Ayurveda consultants, offering the best possible solutions to the patient. For example, we have seen so many cases of non-healing wounds or burn wounds or fissures, fissulas, which are almost untreatable by modern medicines, or certain there is certain limit for these cases where modern medicine can give the best results. And leech therapy, some decoctions which can be used for wound wash, some lepas which are ointments, or some medicated gritas or medicated ghee. All these things are effectively used in this hospital, and results were wonderful. I wish I could share the photographs, but this is just the start. We are definitely going to share more in coming sessions, or in coming more activities by Ayurveda Association of Florida. Networking is such a powerful output or outcome of this India internship. You get to directly talk with the consultants, professors, which are gem of people in Ayurveda, and otherwise it is highly impossible to keep in touch with them or reach them. But this is the opportunity where you can sit with them, you can ask as many questions as, and they will make sure that everything is going fine with your learning. You actually see how the Panchakarma huge setup works in these institutes or hospitals. You get to learn about various instruments, where you can get those instruments, how you can incorporate those Panchakarma therapies in your practice in United States. If we are talking about Netra Basti, everybody knows about Netra Basti, immersing of your eyes in Ayurveda decoction. But Netra Basti is a very it is one of the therapies that can be applied to the eyes, because there are Pidalak, there are Anjan, there are Netradhara. So many parallel therapies are going on. So this is the very rare opportunity for students to learn about all these Ayurveda therapies in presence with proper guided learning. And medicine preparation was very much fun. And it's not about, if you are making triphala powder, nothing rocket science in that. But that session was so interesting, and the professor who taught us to prepare triphala. They talk about adulteration, how to select the best herbs possible. What are the types of amla? What are the types of different ingredients? So learning medicine preparation, or it was a wonderful activity students learn about. We actually visited a full-fledged 125 years old Ayurveda pharmaceuticals, Ayurveda company, medicine manufacturing unit. Students actually saw the huge containers, how they prepared the asavas, how they prepared the tablets, and everything was fun. Uh, we were very fortunate that Goa government also took interest in our activities, and in collaboration with AIIA, they offered us a day trip to Spice Garden where students actually saw the spices, turmeric spice plant, or black pepper plant. You don't get to see these plants. You are using Triphala Churna, you are using Trikatu Churna, you are using Ashwagandha, Shatavari, but it's such a fun to actually handle those trees, actually see the overall, flora in their natural habitat. There were incredible activities going on, and I couldn't finish in 20 minutes, but I just wanted to, um, s- give stress on clinical training. That clinical training is really very important, and you should start going to these internships, whatever eligible criteria you match, and right away you should definitely get involved in these internship activities. I can see a few of my students from HUA also here. So we are learning about Ayurveda nutrition. So there were practicals about Pathya Ahara also. Pathya Ahara is nothing but Ayurvedic diet or Ayurveda nutraceuticals, how you can involve those nutraceuticals into your day-to-day cooking. So that practical is also very much helpful. So yeah, I would be happy to answer it if you have any questions, but I'm sure you will be more eager to hear about the case presentation by Dr. Mohan Joshi. So my time is up. So thank you so much for giving me an opportunity to share my India experience. I'm definitely thinking to write a blog on that. So when it is written, I will definitely share with you all. Thank you so much again.
Thank you so much, Rupali. Dr. Rupali, if you want to just share with everyone on the chat the website address for All India Institute,
Sure,
maybe they have some pictures that they can see, or a virtual
sure,
tour, or whatever is there available on the internet.
absolutely.
Thank you so much.
Absolutely. Thank you.
Okay, so our main guest, all the way from India, very early. I know it must be really very early for you, and thank you for joining us. And we are very excited to learn all about your case presentation, Dr. Joshi.
You, thank you. Am I audible?
Yes.
Okay. So I think you just uh, asked about some of the information related to uh, institute, and I was very happy to hear the experience of Dr. Rupali coming over here in All India Institute of Ayurveda. So first of all, I would like to thank association for inviting me for this session. I would like to take you through the All India Institute presentation within just first 5 minutes, and then probably we'll go for the case. Is it okay?
Sure.
Hello? Hello?
You should make him co-host so that he can share his
Yeah.
slide.
Hello, Dr. Rupali?
Yes, Dr. Joshi.
Uh, can I go through a short intro of the institute and then start with the case?
Yeah. Sure, sure. If you can complete the case
Yeah, I'm just,
and
give me
intro,
one
yeah,
moment.
we would be happy to hear.
Yeah. So you can be the host now.
Okay, is it visible?
Yeah, it is visible.
Yes, so welcome to All India Institute. So we are in Goa. Uh, our mother institute is in Delhi, Sarita Vihar, and this is the Goa campus. You can see Dr. Rupali was just referring to this. Very happy that the campus was inaugurated at the hands of Narendra Modi ji, our Prime Minister, and we have a clear vision to be the excellent in academics and going ahead to be a tertiary care service provider for with Ayurveda services and with UG PG in Goa and UG PG PhD in PG PhD in Delhi. So we are happy to say that we have started with the PG also this year and probably in 5 subjects. So NAC accredited A plus campus. So you can see this facilities over here. This is the 50-acre spreaded campus with hospital, academic blocks, hostels, and canteens. So these are all well equipped, self contained, electricity, water harvested. So our strength is continuously growing. Now we have 3 batches and 20 PG batches. So this you will be happy. We are doing the research, public health initiative research. This Ayush Kashai, Chavanprash, this is institute has distributed more than 1.5 lakhs of these kind of kits, which were very useful, developed by institute for COVID as a immunomodulator, immunobooster, and they are well accepted. And for this, institute has many MOUs, as well as we have our own 2 publications, international publications. You do visit the sites. These are the international publications which are available online, free, and you will get the first-hand information related to research from our websites. So many MOUs at Delhi, in Goa, as well as our leadership. Dr. Sujata Kadam Madam is uh, serving as a director for Delhi and Goa right now. So many initiatives, many activities going on. You will be happy to hear this. We have completed 3 lakhs of patients in just 2 years. And these are the figures 2003 and 2023 and 24. So continuously growing institute. So you can see the difference. The bed occupancy has tripled in just 1 year, and total number of patients also are multifold. You can see the development graph of the institute. With, as Dr. Rupali said, we have all state-of-art investigations and other facilities in our institute. Panchakarma, which is the core, you can see the number of procedures, those are increasing. On the left-hand side, you can see the procedures, Nehana, Svedana, Vamana, Virechana. So continuously they are growing, and these are the OPD numbers. You can see the surgical procedures, parasurgical procedures, Jalauka, Vacharan, Agni Karma, Daha Karma, Ayurveda, Garbha Sanskar, and music therapy. So everything is moving very fast. Number of outreach activities and camps, they are also moving. And these are some of the recent advances, I think, even after the visit of previous batch from USA. So it's with the uh, different institutes, and this is a typical Goa campus with seashore yoga sessions and many other activities going on in the institute as an academic institute. Uh, we have visitors, so we are happy to work with the uh, various organizations across the India with very many activities related to Ayurveda. I'm just scrolling through. It's a big presentation. Many lectures, many outreach programs, rallies across Goa, and various guest lectures for our students. And we are happy to welcome the guest in Goa. So, with this short introduction, now I will go to my case. So today I will be, I'm audible enough.
Yes.
Yeah. So today I will be presenting a case. Probably I will take a few minutes over here to explain a psoriasis case. So I'm working in being in Samhita, being from the basic sciences. I'm happy to work in Ayurveda, and I have two OPDs here, one in geriatric and one in skincare. So in skincare, we come across many diseases. So psoriasis, I'm sure everybody must be treating the psoriasis, being the doctors, and with various ways. So just going through that, taking a hint, psoriasis, it's a chronic skin condition. Prevalence in India is 0.4 to 0.8 max, but it changes. As per Ayurveda concept, we can see that we have different types of geographical distribution. According to the geographical distribution, we say this is a dry region, or this is a marshy or wet region, or seashore related region. So it is a Anupadesha, and dry sandy region is Changal Desh. So considering that we here are in Goa and we have many cases, so our prevalence is much more, and we see many patients, around 50 odd patients per day related to many skin conditions, and almost 20% of them are related to psoriasis. So we have a larger prevalence in Goa. Based on that, many exposures and many working conditions are identified. Usually the common sites are scalp, face, trunk, limb, palm, and soles, as everybody know. And there are again types of psoriasis, investigations, diagnostic test, and mostly the patient what we get are diagnosed patients of psoriasis. So they are diagnosed patients. They have done their investigations. They have taken the treatment elsewhere, and they are coming to us. So now going ahead with Ayurveda, everybody knows, but I'm just making the ground for the further explanation that where to relate, where to correlate. So we put it in a Kushtha. So any skin condition can be kept in Kushtha. And considering Kushtha, uh, it's a complex mechanism to understand the skin related conditions, because they arise in many ways, many shapes, at many sites, with various kinds of characteristics. And this is something as explained in Samhitas, Eka Kushtha. It's a kind of uh, it's a kind of kushtha, where the explanation is it is similar to the scaly appearance like a fish. So Matsya Shakalopama, it's a scaly appearance like a fish, and I have tried to put the both the things together. One more thing, all the pictures are of real patients in AIIA, and this you can relate that these are the patients and conditions that we are receiving very often in our hospitals. So we can label it as Ekakushtam. There may be differences of opinion. Some say it is Vicharchika, some say, but ultimately it comes under Kushta, and it can be, some say it is Kittibha. So considering the prevalence, predominance of doshas, it can be labeled with various ways, but most preferred thing is Ekakushta. So considering that it is Ekakushta, it's take longer time to develop. It's a slow moving Samprapti. Again, it may be congenital. Most of the times we see the congenital pattern following, but it can be initially starting from the first generation patients also, and it's a psychosomatic origin. So this is the most important part. We should not forget in while treating the case, that it is psychosomatic. So association of psych psychological conditions. So whenever the patient is stressed, whenever the patient has some stress like conditions, it there will be a certain aggravation in the disease. So based on that, we have to consider and we have to treat the patients. So etiopathogenesis is basically, I'm just putting the facts so that it will be easy for me to put the case. Viruddha ahar. So the food or the material that aggravates the doshas and couldn't eliminate them can be termed as Viruddha ahar. So this is a peculiar term in Ayurveda. Everybody is familiar with that. There are 18 types of Viruddhas, but the basic definition remains the same: something that aggravates the dosha in the body but cannot eliminate them. So aggravated doshas in the body, they will do many types of symptoms in the body, and that is the reason Viruddhahar is should be avoided. Vegadharan, that is retention of the urges. This is one of the hetus, and it is predominantly observed in most of the patients. Food, basically pitta vitiating food. It's a tridoshaja part. Skin diseases are tridoshaja. You can see the dosha combination, tridosh main, but still pitta dominance is there. So by saying pitta dominant food or pitta vitiating food, we can say that according to the taste, according to the characteristics and peculiarities of the food. Overuse of the spices is one of the reason that we observe in our areas. And dushya, basically the associated factors are skin, then rakta, that is factors which affect the rakta dhatu, mausa dhatu, and kleda. So this is again the ambu or kleda, which is the moisture, and which are the factors which increases the kleda in the body, like consumption of curd, like consumption of some of the dairy products. So it is preparing more and more kleda. Even some kind of food material, fish, and most important, desha, which are again anupa, is or seashore areas or the marshy places that are more kapha dominant. It is one of the reason. One more reason we observe is fish, actual consumption of fish, and fish sea products. Most of the sea products. Here, one of the thing I would like to say that, okay, at sometimes it may not cause the any harm to anyone, because across the world it is consumed. But there is one more factor which we consider is ati yoga, that is excessive consumption. So excessive consumption is one of the factors that we can see. Uh, how many days one expect that one can eat fish? This is again a question for all. I'll be happy to receive the answer in the chat box. Uh, so what is your guess? A patient comes and say, in a 365 days, how many days we expect the patient will consume fish? I'm just waiting for answers. 100. Okay. Oh, just one answer. 3 months. Okay, so around 90. Fine.
3 months is 90. Oh.
Oh, okay. I think twice a month. Oh, twice a month. Okay. Okay. Uh, I think I got sufficient answers. Let's go ahead with the exact answer that I received from the most of the patient. And they say it is almost 360 days in a year
In Goa.
in Goa. So amongst the 365 days, they prefer to eat fish in some kind, say fish curry, or some in other format, almost every day. So they want fish every day. So 360, a few of the days like Ganesh festival and all, they don't eat. Otherwise, they eat every day. So this we call as Ati Yog. So somebody who is doing such a consumption, are exposed to many other factors and increase in the clay, then that may be the reason. So that is the why we consider this as the most important factor. Environment, Anupadesh, I have already explained. So let's move ahead with the case. So it was a 57-year female. So I come across many patients, preferably why I have chosen this case is you can see on the right side. This is a very peculiar side. If you see the patient, otherwise the patient looks normal. But this is the entire scalp is filled with psoriatic patches. Neck is filled with psoriatic patches. Hand, feet, sole. These are all filled with psoriatic patches. I'm sure you can visualize this. Uh, this picture on the right side, you can see that reddish appearance uh, of his skin, and in the scalp, you can see the patches as well as the shedding of the skin continuously observed in the scalp. So patient was really worried. There are a few more pictures. It was a known case of psoriasis. Patient was taking treatment for 15 plus years, so initially diagnosed with a family history of psoriasis, taking treatment. Initially, got good results with allopathy treatment because they were using steroids plus some of the other treatments, and but whenever she stops taking the medicine, it used to aggravate. Again, started with medicine with the same doctor or some other doctor, somewhat relief, and it was increasing. Fortunately, the patient wasn't diabetic, wasn't hypertensive. This is one of the condition because here prevalence of diabetes is also more, and when it comes with the diabetes plus psoriasis, it becomes a different picture and difficult to treat. Itching, severe itching, and shedding of skin. These were the two main complaints. When we examine, uh, uh, constipation was plus, uh, very much constipated patient. AMA, as ma'am said, uh, AMA examination is the important factor, and it was a SAMA patient. That means all symptoms of SAMA across the body, in the tongue, as well as in mala, and in the body with the nadi also. We can feel the SAMATA or SAMA aggravation across the body. Prakriti kapha, Vala, very weak, uh, not so strong, and Agni Manda. So now you will relate this while treating the patient. Scaling and patches on hand, forehead, and scalp. So as we say that whenever we consider the disease, these are the factors to be focused on: Ruja, Varna, Samuthana, Sthana, Samsthana, and Nama. I have the translations written on the right side. I will talk about that. Ruja, here we can say the symptoms. Symptoms are basically explained here. Color. So based on the color, we can see it is moreover Pitta dominant. The condition is a reddish flare, you can see. So it is more or Pitta dominant, though we have three doshas. Here the condition is Pitta dominant, though it is considered as Vata Kaphaja, but still we can see the Pitta aggravation at the current situation. So maybe some burning was there. Uh, Precipitating factor, we always consider hetus. So the initial hetu when the patient came was she has stopped the treatment approximately 2 months back. All other kind of treatments, and there were festive season, so many kind of fish and types of fish consumed, and stressful life. uh, these were the noted factors as a precipitating factors at that moment. Sthana, I am going to show the next pictures. Skin mostly, and diagnosis was Ekakushtam. So here you can see on the forehead, in the entire skull, and the back. Everywhere you can see these symptoms which are present, and Now I'm going to the management principles. So usually what we consider is first whether the disease is Nija or Agantu, is it the external origin or internal origin, then Samaniramata, then Nidan identification. So um, I have already explained while saying these are the three factors which were identified and now we have to avoid them. So this was a really challenging thing, how to convince a patient who consumes the fish 360 days a year that they should not consume the fish. So this is the most challenging part across all the treatments. Then Siddhantas, basically Samanya Vishay Siddhanta, Shodhana Shamana and Rasayana. These are the three principles that we follow every time. First is Nidan Parivarjan, avoid the basic root cause, what we expect. Second, purification, or third is pacification of doshas. And then we go for the Apunarbhava Rasayana treatment. So the plan was clear here also. Nidan Parivarjana, stop the etiological factors. So first convince the patient, and it was actually not a good season to start with many positions. So patient Bala was poor. The season was summer. So in summer, usually in the hot conditions and areas like Goa, where the humidity touches almost 90% and the temperature is 35 degrees, around 35 degrees centigrade. So we don't expect Shodhana procedures to start with Shodhana procedure. So this was again a constraint. So we started with Langhana, that is fasting, and fasting was done. Uh, Pachan and Deepana, considering the armor, started with Deepana and Pachan. So Agni needs to be taken care of. Once the Agni improves, then the remaining dosha Pachana or will take place, and then it will become very easy for us to treat the conditions. So just a fasting, with just fasting, and one more thing that we have added is Sansarjan Kram. So Sansarjan Kram is usually done after the Panchakarma. So after the Panchakarma, when Agni is at its low position, to bring him up to the aggravated condition or increase the Agni, we gradually increase from liquid diet to semi-solid diet and then to solid diet in 5 to 7 days. So this is a Sansarjan Krama. We start with just rice water, then Mudka Yusha, and gradually increase up to the Indian breads, different kind of Indian breads like Jowar. So this was followed in this patient also. The options were Shodhana and Shamana. Shodhana was out of question considering the season. So we started with Shamana, Shaman in the form of internal treatment as well as external treatment. And the plan was decided like this. The management plan was similar to this. So initially, Shodhana not possible in Grishma Rutu, and patient was also weak. So we decided not to go for Shodhan. Then started with Langhana, just Koshna Jala and only Sansarjan Kram, Mudga, Yush, green gram, cooked, very liquid first and gradually increasing, Laja or rice flakes for 1 week. So it appears a very different kind of approach with food, but we have stopped the entire food and shifted the patient on Sansarjan Kram for 1 week, and started with Shamana medicines, where most important treatment was Mahamanjishtadi Kosha. Uh, the Manjishta itself is the key drug in any kind of skin conditions, along with so many drugs in Mahamanjishtadi Kashai. We usually prefer the powder form. We give the powder and explain the patient how to prepare the decoction, fresh decoction. So there are again ready-made decoctions available, but fresh decoctions to start with are considered good. So we give the powders. It's a combination of Mahamanjishtadi Kashai available, and just prescription is written that okay, 1 teaspoonful with 4 cups, and reduce it to the 1/4 cup. So that is a 1/8 time. It is as per the scientific method, which is explained in Sharangdhara. Then Patoladi Kashaya. So Pachan was important. So Patoladi is one of the key ingredients of 5 components, and it actually works on the Rasa and Rakta Dhatu. So initially targeted Rasa and Rakta Dhatu needs to be purified, and that is the reason Patoladi Kashaya was started for the Pachana. It is ready available, Kashaya, with us. So 10 ml with 40 ml of water after food was prescribed. Uh, does it follow the tattva of Virechana? So in skin disease, we prefer that Virechana is one of the key treatment considering the Pitta dosha. And this Kashaya itself act as a Pachan as well as Virechan, mild Virechan. So that was one of the key components considering that. Agni Vruddhi was required, so Shankavati 2 tablets. So I can say that these all formulations are herbal formulations, nothing metallic, nothing uh, mineral part is used, all are herbs. External application, Dhatturadi Tail. So this is very much useful, specifically in scalp conditions, what we have seen in this particular patient, and itching. Both the problem Marichadi Tail and Dhatturadi Tail. Dhatturadi Tail, Dhatturpatradi Tail, or Dhardurapatradi Tail. These are the different variations of names which are observed, and it works wonder. Within a 5 to 8 days, you can see the initial shading stops. So that much fast result we can expect with this. But again, it is a temporary. Unless we give the internal medicine, it will not be consistent. So considering the mind and the specification of mind also, a Nasya treatment was started, and Snanam. So for bath, Panchanimba Churna, it is available. It was given for the scalp massage, and then bath, and even in the body parts. So this is a kind of scrub we prefer to apply. And with this, the initial treatment started. In after 15 days, slight reduction in the itching was there. Agni was better, and Samata still it was there. Constipation was less. So Samsarjan Kram was increased for 1 more week. So now we have a patient with 1 week of Samsarjan Kram and remaining food. Completely stopped fish, which was the etiological factor considered. And to our uh, help, there is one more reason, that it was a dry season. So it wasn't that wet. So aggravation, further aggravation of kapha was not there. So patient initial symptoms were reduced. Yeah, after 15 days, it was thought there is much purification required. Was Sukhasarak Churnam, which is a Trivrata formulation which initiates the Virechan. It was also added, and was continued. After 1 month again, itching completely stopped for the scalp, uh, and other body parts, they were still itchy. Color was becoming gradually normal, and skin thickening was slightly reduced. Samsarjan Kram was again increased for 1 more week. So now you can see that in a 1.5 month, we have given the 3 cycles of Samsarjan Kram. That means it's a different way of putting the patient on a different kind of dietary regime. We can say that it is a part of the Langan. Langan is again further divided in 3 parts. One is entire Langan. So second part is Langan with a few kinds of altered food. Um, that is for Madhya Dosh, and for Uttam Dosh, that is a Langan directly. Shodhana is third kind. So Shodhana, Langan Pachana, and Langana. So considering first grade, second grade, and gradually when patient, we can convince the patient that yes, it is working. So this is one of the factors that I have observed. Whenever we convince the patient, they are reluctant, but when they gradually start with the treatment and symptoms reducing, they can observe that only 2 medicines or 3 small medicines were prescribed, nothing much, and the symptoms are coming down gradually. So a patient was happy. He continued with the treatment, and uh, we got very good relief after 1.5 months. So it's the first 15, then again 15, and now it is third 1.5 month. So after 2 to 3 months, suddenly patient came back and itching was increased. When we actually went to history, uh, again patient could not resist because it was from summer it came to the rainy season and fresh fish was available. So it was a history of again shellfish eating with some other stress, family stress, patient explained. So again added with one cycle of Sansarjan Kram, and now the ama wasn't there. So with a pachan of 2 months almost, uh, patient was Niram now, and we can go for Ghruta. So here we started the Panchatikta Ghruta Gugul, which is directly acting on the skin. So first time added anti-inflammatory compound with Ghruta, and it was working good. It actually works good. It's a choice of drug uh, earlier also in the Niram condition. Mahamajishradi Koshai, Patoladi Koshai continued, and one more thing added, Shirodhara. So 5 days of Shirodhara was added. Actually, this was not good season for Shodhan, so we waited till further one more month, and in the month of Sharad, when the rain stopped, uh, patient was Niram, symptoms were reduced. Still, we went for Snehapan with Panchatikta Ghruta and Virechan with Trivrut Leha. So it was an admission procedure. Patient was in the hospital for 7 days and followed by Sansarjan Kram for 1 week. And after, in the 15-day follow-up after the Shodhana, patient explained that no rash, no patchy skin, no symptoms. I'm not saying this is the finally the end of the disease, because the nature of the disease is such that it will come back. It will come back whenever a patient will start consuming the normal food. But still, patient said that at few times, once a week or twice a week, patient is having the normal food, fish, and all kinds of fish. Still, even after the 4 months of follow-up, the condition is condition was stable, and we shifted the patient to only one medicine after the Shodhana, that is Mahamanjishradikvat, and Praval Panchamrut continued with Nasya with Brahmi Grita. So these were the medicines given further. Then we lost the patient to the follow-up. So probably whenever we lost to the follow-up, that means the patient is good. So whenever we will see him back, it's almost 8 months now. There is no follow-up, but patient is referring the further patients to us, considering that he must be in a good condition. So here is a short story, and there are many such. You can see many such conditions, many such cases. It's a very interesting. I think whether is it feasible or not, I have to check. So you can see this one patient that I have moved. Entire scalp was filled, and he was also cured with Shodhana, Virechana. It took 3 settings of Shodhana to almost 7 months to clear this condition. And I don't have the latest picture, but he is doing very well, and he is still giving the follow-ups. So there are many conditions which show very early result. Sometimes Kushta or skin condition is something which actually takes time. Actually, it's very difficult to treat and takes time because it's a final um, reflection on the body parts, across the body parts in psoriasis. And still, we are getting good results, and there are many success stories with the Shodhana and all other procedures. I think I can stop here. And if there are any questions, I'll be happy to answer. And
Aparna, are you
I
there?
see. Yes. So thank you so much. This was very, very impressive. And yeah, this did you use any Jalauka for this patient?
no, Because the nature of the disease is such that it is across the body, so Jalauka was not used. Again, uh, when we started, it was a month of May, Grishma. So it was a May month, and availability of Jalauka is also poor because usually we get Jalaukas in July. So it is very difficult to maintain them. Still, we don't have. Soon we will be having a pond for Jalauka reproduction also. So then we can do that.
Yeah, I see in the chat box one of the attendees have asked about giving patoladi after food. What is the rationale for that?
It is it was a pre that is a ready-made kasha, and it is bitter in taste. It is very much bitter in taste. So that is for the palatability reason, we prefer to give it after food, and again 4 times of water. So before food it is difficult, and during food patient may feel that taste and probably will not consume the food appropriately. So it's a entirely kind of palatability consideration for this. According to the doshas we can say, but for pitta it is okay. And again, ready-made kashas, they are quite sharp. So that's how it was planned after food.
And do you also advise them to be diluted in water before
4 times.
consumption?
4 times. 10
4
ml of
times, right.
kasha, 40 ml, total 40 ml of water. So 50 ml total.
Oh, okay. Yeah, anybody has any questions, they can just unmute and ask it directly.
I have another question. Thank you so much, Dr. Joshi. It was really, really nice to listen to this case. Amazing outcome as well. One question is what is the rationale behind the Praval Panchamrit? Was it mainly for Pitta Shaman as well as for the excess clay?
Yes.
And
Yes. Pitta Shaman, I came across and said it was a Sharad Rutu. So even after the Shodhana, Virechana, patient was feeling some kind of daha, so
Okay,
Panchamrit was continued.
I see. Okay, okay. Thank you.
Florida has similar weather to Goa, so we could, have very similar protocols or even the hetus for a lot of our local patients here. Any other questions? And I'm sure a lot of Floridians have similar situation, 365 days a year, eating different types of fish.
Okay.
That's true. Thank you very much. This was fascinating.
Thank you.
Okay, any other question? Okay, that's great. So thank you so much for giving your great presentation and taking this time so early for you in the morning and presenting this to our Ayurveda Association of Florida. I'm very happy to know that a lot of people are showing interest, and please do come back. All of you are invited for our monthly webinars. So please do sign up, become a general member or professional member of Ayurveda Association of Florida, whichever category you fall into. But do participate, become our member, and we can do a lot of exciting things together. So every month we will have a webinar and we will have different guests. And I'm sure we will invite Dr. Joshi again to do more presentations. This was really exciting. and
Thank
very, very happy to have you here today. Thank you so much.
There is one more question which is unanswered in the chat box. Can we take that or
Yeah, sure. Maybe I
so?
missed it.
How to best guide such cases at the Ayurvedic counselor level since scope isn't clinical?
Okay. No, that I guess we will have to answer that. How to best guide, I guess, with food, with the diet.
Okay, I will try, and I will try. Actually, you are in a better position to guide because we have that free hand to add the medicines whenever and wherever required. But even with only Samsarjan Kram, you can start with,
Yeah.
and you can replace something like Manjisthadi. If it is not available, the single Manjistha herb is available. So you can go for the combination of Sariva and Manjistha to start with. Add Haridra also. So Haridra, Manjishta, Sariva, you can start with. It will also work in a similar manner, not to that extent, but in a similar manner. If Sukhasarak is not available, then plain Trivruta may be available. You can use that as well. And if you don't want to use, then you can have a alternative. The principle should be followed. So here comes the Samhita Siddhanta. So Virechana is principle. So you can replace it with castor oil. You can replace it with any other thing which is available with you. Otherwise, you can replace it with food also. So you are better judge what to advise in such condition. Uh, so to relieve the constipation, that is one of the important part. So and purification of blood. So single herbs can be tried. Shunthi can be used for pachana. Shunthi can be one of the alternative if patoladi and all are not available. I guess that will be a constraint. It should not be, but if it is a constraint, then you can go for alternative plans also. Otherwise, just go for the Samsarjan Kram. Usually 3 to 4 cycles of Samsarjan Kram, if we follow, it shows very good result on skin conditions. We just need to have very, that is the moral strength of the patients to follow that. Eating, going on the Samsarjan Kram only, not eating, that is a psychologically disturbing thing, that only liquid diet and semi-solid diet needs to be taken for the entire week. So that remains a challenge. But gradually, after one cycle, we get more acceptance from the patient as yes, he also get confident that yes, I can do this.
Okay, somebody is asking, how about river fish? Like, is it mostly like saltwater fish or even freshwater fish? That is the part of the etiology or like hetu.
Basically, fish is a fish, so it will moreover have the similar characteristics. Saltwater fish are mainly not considered that guru, and these are more guru. So that's what sthirasharira avayavaha swabhava dhato kriya lingam pramanam samskaram matram jasmin parikshati. That is the guideline given by samhitas, that even for any kind of fish, we can consider these factors in an animal from origin, which origin we have. So considering these 10 factors, we can decide the what should be the characteristics of that meat, and based on that we can take a decision. So that is also one of the thing we can work on. But I haven't tried this because actually I am a vegetarian, so I don't actually have the first-hand experience of having the fish. So that is one of the reason. Uh, that's all I think for this question for me.
I think this question is really very important because at the level of Ayurveda counselor, this is the best step to educate your clients, patients, friends, and relatives about, incompatible diet and how they can take toll on your immunity and such immune compromised diseases. You can work best level on Ayurveda nutrition, like low salt diet or using unfiltered or unrefined oil. So Ayurveda nutrition lifestyle and dinacharya will be your powerful tools to deal with such cases. And the herbs that Dr. Joshi has mentioned, they can also help a lot.
Yeah, a lot of kitchen herbs, and also the food like wrong combination, like marinating the fish with yogurt, like those kind of things.
Yes.
Thank you. It was a wonderful case. Thank you so much, Dr. Joshi.
Thank you
Yes.
so much. Yes.
Actually, I came to Delhi for one of my work, so you can see me this in odd situation. Otherwise, in Goa, we don't need
Yeah.
anything.
We were wondering how can Goa be this cold?
No, no,
Yeah,
it's
I was wondering, like he's wearing a
nahi,
winter.
Delhi is really cold. They are around
Yes.
11, 10, 11 degrees. It's good for you, good for us. It's very cold for us, may not be for you. Thank you.
Thank you.
Thank you so much. Namaste.
Should I
And
leave? Thank you.
Thank you, everyone. Good night.
Good night, everyone.